All right. Here is another anatomy lesson on the kidneys. So here is a pig kidney that I'm going to go over the surface anatomy of it and then quickly dissect it. Then we'll analyze the internal anatomy. I've also got a couple that are already pre-dissected that we're going to take a look at as well. You'll notice some of the staining on the outside of the kidney. Now, mind you, the renal capsule, the connective tissue capsule that encases and compartmentalizes these organs normally in situ has been removed. So normally there would be this white opaque look to the kidney if it were just freshly removed from the body. Again, these are pig kidneys. So mind you, that's been taken off. Already as I ordered them. And then you'll notice some staining on the outside of these, red and blue. That's obviously not natural. These kidneys have been injected with dye, so you can see the arteries and veins as well, because in my anatomy classes, I hit renal circulation very hard, because if you look at kidneys for what they are, remember they are literally dialysis machines. Just our evolutionarily created versions of them. Because remember, the kidneys are our main waste removal system of the human body. They remove many different forms of metabolic waste from our extracellular fluids via circulating blood into them. So that's why understanding how blood flows through kidneys will lead you to understanding how the kidneys undergo the process of dialysing our blood to remove waste, excess water, excess solutes, things that just aren't necessary in our extracellular fluids at the time. And obviously you'll see the implements I'm going to use to make this happen. So remember, the kidney has a convex surface and a concave surface. Remember, convex outwardly curved, concave inwardly curved. Now, always remember that the convex surface, the outwardly curved part of the kidney, is the lateral side of the kidney. So that's always facing out towards the lateral sides of the abdomen. And then the concave part of the kidney is the medial side, which obviously faces towards the middle of the abdomen. Okay, sorry, I'm still going to use this document camera. But, all right, now let's look at the medial side a little more, because this area is what we refer to as the hilum. As you would have learned, hopefully you went over the respiratory system before this, because there are a lot of anatomic parallels between lungs and kidneys. In terms of each of them has a hilum, the drastic increase in surface area of the internal anatomy that allows both those organs to perform their functions at the most optimal levels, and so on. But the hilum is what I always consider the high traffic area of the kidneys, where everything goes in and out. Same thing with the lungs. Okay, so let's examine the hilum a little more. So good. The rubber band was removed. So first, when we look here, you'll notice that there is this just this physical space. That's just what we would call the renal sinus. Okay, and normally, like anywhere else in the human body where there's a physical space, it is going to be occupied by connective tissue. In this situation, small amounts of fat. And if we're talking about structures going in and out of the kidney, we're talking about basically the renal artery, renal vein, and then the ureters that carry urine from the kidneys down to the urinary bladder. Okay, so let's identify those real briefly. So normally there's if you see where it looks kind of nice and cinched right there. So basically what the company does is they, I ordered these from BioCorp out of Minnesota, very good company. What they do is, so here, this is the renal artery. This is the, what's converging into the renal vein. And then this here, see that little tube right there, that is the ureter itself. Okay, so what they would have done to make the arteries and veins stand out more on the inside of the kidney is they would have basically taken this renal artery here. Now remember, arteries have thicker tunica medias, remember the muscular walls, right? Arteries are much more muscular, and their lumens are more narrow in diameter than veins on average. Always remember that. So you can see that this vein that's been cut open is very thin-walled, but has a large lumen. Again, this thing's really been cut open. So, but notice this is much thicker than that. Okay, and so what they would have done to make the internal vessel stand out is they would have taken red dye, or not, kind of a red plastic in the form of a liquid, just engorged it, injected the inside of that renal artery to let the as many arteries as possible fill and distend. And same thing with the veins, that they would have injected blue dye, and then what they do is they take a rubber band and cinch it off, and then that obviously holds all the plastic inside, which allows the vessels to fill and expand. And then obviously once the liquid plastic cools, then the vessels stay in that distended state, and you can tell the difference between arteries and veins because they're red and blue. Okay. And then the ureter, remember the ureter is what goes down towards the urinary bladder, where it will attach to the posterior side of the bladder to deliver urine that has been produced by this kidney. And the bladder is the purse or the pouch where we're going to store urine until we need to void ourselves. Now, one thing about the ureter, I'm trying to get this as clear as I can, sorry. One thing about ureters is they have very narrow lumens, and their mucosa, the inner lining. That looks terrible. I'm sorry, folks. So the lining of the mucosa, I know it's hard to see on this video, and I apologize, but you can see hopefully you can see, it's very folded, all right? It's very, very folded. So the mucosa is very narrow. Remember, it's lined with transitional epithelium. Now, the mucosa, or the lumen, remember the lumen is the hollow part of the hollow organ, does not have to be that wide, because this is a tube that's merely carrying, fluid down to the bladder, right? We don't need urine to just drop down at a rapid rates and have our bladders fill really quickly, because then we'd have to be going all the time. So basically, so that's how you can tell you're looking at the ureter. Plus, obviously, there's no dye that's been injected in it as well. All right. So, and then you can see that it's surrounded also by this fatty connective tissue. All right. So that's those are the major components of the hilum. Now let's cut this thing open and look at the inside. So usually, what I instruct students to do. Grab this stinking scalpel. What I instruct students to do is to basically make an initial incision. So basically what I say to do is to basically start at one end of the hilum and to make an incision all the way around to the other side. And then what I tell them to do is to simply, after they do that, cut from lateral to medial. All right, so I will demonstrate that here. Stand up and do that. All right. Okay, and obviously always be very careful, as I make sure, whether it's myself or lab assistants, that we change our scalpel blades after every dissection, because I'm of the opinion that sharp blades are safe blades. If everyone knows you're working with sharp equipment, you need to be careful with it. All right, so you can see there's the initial incision, and then now we're simply going to cut from lateral to medial. Alright, so with the resistance that I'm getting while I'm doing this cutting is coming from the drainage channels called Calyxes, which you can start to see right there, those kind of white pouches you see in there. I'll explain those more in a moment. So let's continue to cut this thing open. Okay. Ooh, a little bit of formalin got stuck in here. That's lovely. Alright. And there we are. Okay, that's lovely. Okay, so now that's what it's going to look like when you cut it open. Obviously, this is some of the plastic I was talking about right here that was that got stuck inside the arteries. So basically, here we now have the inside of the kidney exposed. And that's simply how you cut it open. Now I'm going to bring over a couple of others that were already dissected that yielded some more excellent views than what I just did right there. So, okay, so let's examine the internal anatomy a little more. So if we look up close here at this kidney, so again, this area here is the hilum that's normally occupied again by fat and that renal sinus. All right. Now you see this lighter colored tissue on the outside, that is the renal cortex. Always remember that word cortex means functional outer covering. That is the outer part of the organ that actually contributes to the function of the organ. Like for example, the renal capsule, the connective tissue on the very outside, does not contribute to the actual process of urine formation. It just merely helps to hold the kidneys in place and compartmentalize it from surrounding structures in the area. So that is not a cortex, all right? This tissue on the outside, however, that has a large surface area of little microscopic structures called nephrons that are used to, that are like our version of dialysis tubing to make, that we use to produce urine with after blood is filtered. So that would be the renal cortex. Then you see these kind of darker colored areas that look a very triangular shape, almost pyramidal shape. Those are called renal pyramids, which are also within the renal medulla, the middle parts of the kidney. All right, and then, oops, my probe. All right, sorry. And then there are areas of cortex that dip down in between the pyramids that are called renal columns. All right. So there's a renal cortex, there are renal pyramids, which are also part of the renal medulla. There are renal columns, okay, areas of cortex that dip between the pyramids. And then there are these drainage channels here that begin to remove urine out of the kidneys after it is produced, okay. So the tips of the pyramids are called renal papilla, all right, and if you look closely at these renal papillae are actually very porous because remember this is where the distal ends these are where the distal ends of collecting ducts converge, and then finished urine starts to drip out of these into these calyces, okay? These calyces, as I already mentioned, are drainage channels that simply begin carrying finished urine out of the kidneys themselves. Now, every single pyramid is going to have an individual calyx to itself, or it's going to have its own individual drainage channel, okay? That is what we would refer to as a minor calyx, okay? Now, where two or more calyces converge together, we would call that a major calyx, okay? So major, remember, meaning bigger, minor meaning smaller. So a minor calyx will begin collecting urine from a renal pyramid, and then then they will converge and form into major calyces. And all major, there's usually about, depending on the size of a kidney, anywhere from usually about 3, possibly 4 major calyces to a kidney. All right, and all the major calyces are going to converge at the hilum and form what's called the renal pelvis. Okay, now the renal pelvis will basically be the beginning of the ureters, so urine can be drained down to the bladder. So that's actually what I'm sticking this into right here. If I were to put this all the way through here, that would eventually come out the end of this. That is the ureter on this particular kidney. And again, you can see the convoluted or folded mucosa, the lining of it there. All right. So again, the hilum. This would be the renal cortex, renal pyramids, renal columns. And if we take a pyramid and look at the cortex that surrounds it, we would call that a lobe. Okay, renal papilla, or papillae if we're using plural form. A minor calyx for each pyramid. A major calyx where 2 or more converge. The renal pelvis where they all converge at the hilum, which is now the beginning of the ureter, and urine will begin to flow through here on its way down to the urinary bladder. Okay, so as you can see, the gross anatomy of kidneys is pretty cut and dry and very easy to just figure out and go over. Okay, so and then actually there's a papilla right there. That's kind of cool. Ooh, get a little more up close. That's kind of neat. Then there's this calyx that it drains into. Okay. All right, so that's kind of the major gross anatomy. Like I said, not all that bad. Now, a couple snippets here. So, like I said, there's a lot of structural parallels between the kidneys and the lungs. So remember, you would have learned with the lungs that there is a primary main stem bronchus that distributes air into each lung. And then those bronchi, immediately as they enter the lungs, begin to branch into secondary, tertiary bronchi, and eventually form bronchioles. So we go from having one major airway into each lung, and then we have, millions of alveolar air, a little over 1 million alveolar air sacs in the very outer areas of each lung for gas exchange purposes. Similar concept here. We have one artery that enters each lung, and by the time those arteries get out into the renal cortex, we will have a little more than 1 million individual capillary beds spread all throughout the renal cortex, so we can filter blood. That by increasing the surface area that we circulate blood through, that maximizes our surface area, or that creates a vast surface area, which allows us to maximize our ability to filter and remove as much waste as possible from our blood. All right, so that's why it's important to understand the circulation of blood. So blood is circulated out to the renal cortex, where the very important initial step of urine formation occurs, filtration, glomerular filtration. Okay, and then that filtrate will flow through the tubules of the nephron, and part of those tubules do dip down into the renal pyramids, you know, the nephron loops, and then back up into the cortex, and then eventually back down via collecting ducts, and then finished urine drips out. Okay, so now let's take a look at that with a little more detail here. And look at the circulation of blood into the kidneys, so in and out of the kidneys. Now, like I said, by being able to tell this story of blood flow in and out of the kidneys, you're literally describing you're on your way to describing the process of dialysis itself. Okay, so again, each kidney has a renal artery that initially distributes blood. There's the renal artery right there. That distributes blood into each kidney, and immediately, I mean, even before the renal artery starts entering the hilum of the kidney, it is already going to start to branch. And its first initial branches, which you see here, and there's one there, are called segmental arteries, and the name is very simple. They're just branching into very specific segments of the kidneys, you know, upper, middle, lower segments, okay? Now, segmental arteries then, as they project towards the renal cortex, notice they already begin to branch as well. Now, I mentioned a moment ago that the area of cortex surrounding the pyramid is what we would call a lobe, okay? So these branches that project up through the renal columns are called interlobar arteries. Remember, the prefix inter means between, so these are going up between the lobes. Okay, simple as that. And now what we have here are what are called arcuate arteries, which these never usually, I'm never usually good at getting these out, but arcuate arteries do what the name says. They arc around the bases of the pyramids, as we continue to work our way up towards the renal cortex. So notice, like anywhere in the systemic circuit, whenever we are trying to distribute blood anywhere in the systemic circuit, arteries branch, become smaller in size, which in turn increases their distributive surface area throughout the organ or area of the body we're trying to distribute blood to. Because remember, we're trying to get as much blood as possible to as many cells as possible all at once. Okay. No, a lot of times I hear students call these accurate arteries. It is inaccurate to call them accurate, but it is accurate to call them arcuate. And that's going to create confusion, I apologize. So, okay, so then arcuate arteries project, or basically wrap around the bases of the pyramids, and then they literally radiate out into the renal cortex, all right, which that's what a lot of these little red streaks that you see here. And those are what we would call cortical radiate arteries. And again, it's all in the name, radiating out into the cortex, okay? And then from there, we can no longer see the circulation because this is what we would call the microcirculation. You know, we are going to have what are called afferent arterioles, which carry blood to glomeruli. And those are the capillaries where blood are going to be filtered at the beginning of the nephron, called the renal corpuscle. Then efferent arterioles will carry blood away from those glomeruli and mostly form these complex networks of peritubular capillaries or vasa rectas, depending on what type of nephron it is we're talking about, but same concept with both of them. And they will participate in the next major phase of urine formation, tubular reabsorption and secretion, which I'll go over more in depth in physiology videos, where we have to make sure we continue removing waste from blood and reabsorb useful substance back from blood. Because one thing I say a lot when I'm first introducing this topic is it's to our benefit that we not only filter blood in the renal cortex, but we excessively filter blood. We overfilter it, which allows us to maximize waste removal. That, however, also means we need to return as many useful substances back into the blood as possible so they're not lost via urine. Okay? And then, once blood is done flowing through peritubular capillaries and that reabsorption and secretion process is complete, now that what I would say dialysed blood can flow back out of the kidneys and return back to the normal circulation. Now, the nice thing about knowing arteries in, all you have to do is just go in reverse with the veins out. Okay, so you see all these little blue streaks in the renal cortex there. Those would simply be cortical radiate veins that would then converge and become arcuate veins, which then converge and become interlobar veins, which then converge and become segmental veins, which then eventually converge and become the renal vein. And then the renal vein would basically connect with the inferior vena cava, and that again, dialyzed blood would then be distributed, back to the would eventually work its way back to the right side of the heart, and through the pulmonary circuit and so on. Okay, so that's why that's why it's important that you understand circulation as well. So again, just to review here for a moment, we've got the renal cortex here. The areas of cortex here are renal columns. These are renal pyramids, and it should be obvious as to why anatomists would have called these pyramids. They're very triangular shaped. The tips of the pyramids would be renal papilla, which again are what drain finished urine out of the kidneys. The individual drainage channels for each pyramid would be a minor calyx, and then minor calyces converge to form major calyces, and where major calyces all converge in the hilum, that would be the renal pelvis, which is essentially the beginning of the ureter, where then again finished urine will be distributed via the ureter on each side down to the urinary bladder. All right, and then obviously once the bladder is distended to a certain point, then we will enact the neurological mechanism of the micturition reflex, and then we will go from there, which again I'll explain in different content. All right, and then again, just to review the circulation here real quick. As the renal artery enters the hilum, it branches into segmental arteries. As segmental arteries project towards the renal cortex, they branch and form interlobar arteries, which ascend up the renal columns. And then once the interlobar arteries begin wrapping around the bases of the pyramids, as they arc around the bases of the pyramids, we call them arcuate arteries. And then those will project out into the renal cortex, and those little projections are called cortical radiate arteries. And then next, and you just have to know these in order, afferent arterial, glomerulus, efferent arterial, paratubular capillaries, and then we go back out. Cortical radiate veins, arcuate veins, interlobar veins, segmental veins, renal vein, inferior vena cava, and then that is that. So, and real quickly, we can write this out. So I always think it's important to do that. So again, if we are talking about the circulation of blood, into and out, remember we would start that story with the renal artery. Okay. And then the renal artery branches into segmental. Okay. And then segmental arteries, as they project towards the renal cortex, they branch and form interlobar arteries. Okay. And then interlobar arteries arc around the bases of the pyramids, hence they are arcuate arteries. And then as arcuate arteries wrap around the pyramids, there will be many projections out into the cortex, or many radiations out into the cortex, hence cortical radiate arteries. And then again from here, now we're working our way into the microcirculation. We would then start with afferent arterioles. Okay, remember the word afferent means towards, so these are carrying blood towards the glomeruli, the specialized capillaries for filtration within the kidneys. And then efferent arterioles carry blood towards the tubular structures of the nephrons, which will then form into what we would call paratubular capillaries. And again, as I mentioned a moment ago, this is the microcirculation that we cannot see with the naked eye. You just have to know the order that this goes in. Then once this exchange process is done, then blood will then have been successfully dialysed, and then we need to get it back out. And as I mentioned, just go in reverse. Blood begins to circulate out via cortical radiate veins. They then converge and form into arcuate veins, which then will then converge and become interlobar veins. And then interlobar veins converge and form into segmental veins. And some books don't recognize segmental veins as being there, but we just saw them literally right there. So, and then segmental veins will converge at the hilum into the renal vein. And then the renal vein eventually reconnects to the inferior vena cava. And then that blood will again go back to the heart. And I'll also remember, obviously, the renal artery is a branch off of the abdominal aorta. Okay, so if that's something you want to pause and kind of write down that sequence of and whatnot, you know, I think that would be a good idea. But like I said, this is a very important process to understand, because this is the beginning of telling the story of how blood is dialysed. This is the story of how blood is distributed to the machinery, i.e. the nephrons, where blood will actually undergo the process of dialysis. And as blood flows through these vessels and the tubes of the nephron, the process of urine formation occurs, and then once blood is done flowing through these microstructures, then that dialysed blood is then carried out of the kidneys and back into the circulation. Okay. All right, well, I hope that kind of brief video helped you better understand just basic renal anatomy and blood flow in and out of the kidneys. You know, this is a very important process to know and understand. And as always, if anybody has any questions, always feel free to ask. All right, good luck and happy studies, and well, go kidneys, I guess.